the church constitute, at least from the last census statistics, constitute more than 86% of the population. So it's quite a large number of people who identify themselves with the church. When it comes to active church participation, maybe that number could go down maybe to 70 or so. But still, that is quite a large number, large portion of the population. And for this reason, we have an assumption that actually, if all members of the church were participating in this vaccine program, we could have seen many people. We will have passed the 60% look back. But there are a number of reasons why we have seen a slow uptake from the church of the vaccines. First, when the pandemic broke out, there was a sector of the church which spread some misinformation from the cause of the pandemic, the reality of the pandemic, whether it really existed, to the treatment, how it was supposed to be treated. And these myths created or compounded the way people processed the whole idea of the pandemic. And because many of these people were spreading this message, this negative message, were church leaders, especially from some sectors of the church. This really challenged how people were going to respond to prevention and now to the uptake of the COVID-19 vaccine. Yes, there are a number of misconceptions. One misconception was that the pandemic was actually a ploy by Satanists who wanted to make sure the whole global population was going to get the mark of the beast, which is a 666 number we find in Revelation. The assumption was that if everyone was going to be vaccinated through that vaccine, they were going to be inscribed that number 666. And many people believed this because it was there were many sort of false sources that were being quoted, that we are quoting this. We know that Bill Gates, for example, has been sponsoring this because he is saving the interest of that 666 agenda. Other myths had to do with the fact that this was a biological warfare between China and the United States of America, and this was a war that was being waged before the end of the time. So the idea was that we were in the end of the world. I think the first task is to continue sharing the right message, because that there's no alternative to correct information. But the second task is for us to demonstrate, as church leaders, to demonstrate that it's possible to be vaccinated without you dying. And many of us have done that. Our vaccination was done publicly and shared so that our members could see that. So that will allay the fears of many people when they see religious leaders taking up the vaccines and demonstrating that it's safe to do so. But I think what we also need to do is to continue making sure that our religious spaces comply with the World Health Organization protocols, and so that we can show that in addition to vaccines, if we continue to keep social distance, we are masking up, we are sanitizing, we can actually minimize the death of our people. The good thing is that COVID-19 has not skipped any family. Almost every family has had either a neighbor or someone who has died as a result. So we have now passed the stage where people were saying, no, it doesn't exist. We have lost clergy, we have lost pastors who were trying to help people. And for this reason, we are also, I think, at a stage of openness to this information than we were when we started.